students, welcome back to the GDC classes. So dear students, under the series of MRB Pharmacist preparation, we have started the Master Stroke series, under which we are going to conduct all the classes regarding the important MCQs, and those are highly efficiently and most recommended question for the MRB Pharmacist exam preparation. And under this series, today we are going to take the question from the Pharmaceutical Jurisprudence, and the topic is going to be the Drug and Cosmetic Act 1940 Part 1, because DMC Act is most important chapter under the Pharmaceutical Jurisprudence. And DNC Act always give you 2 to 3 question in any pharmacist examination. So let's discuss all the important question under the DNC Act. So in this series, we are going to take the question from the Drug and Cosmetic Act 1940, rules in 1945, and new amendments. This is going to be the part 1. So here is the first question. When was the Drug and Cosmetic Act was passed? So Drug and Cosmetic Act. Now, Drug and Cosmetic Act was passed in 1940, and the rules of the Drug and Cosmetic Act passed in 1945. And on the 1940, on the 10th of the April 1940, this act was enacted. So 10th April 1940, Drug and Cosmetic Act was passed on 10th April 1940. There various amendments have been made from 1955 as well as 1960, 62, 64. And the main objective of the DNC Act to regulate the import, manufacturing, distribution and sale of drug, while the rule of the Drug and Cosmetic was passed in 1945. Next, under the Drug and Cosmetic Act, the rules are divided into how many parts? Now, actually, the Drug and Cosmetic Act was divided into the 18 chapters, 18 parts, and these 18 parts are the rules. Yes, under the rules, there are total 18 parts have been there. Drug and Cosmetic rules have been divided into 18 parts, each dealing with the particular subject. And while there is 2 types of question can be asked here. How many schedules are there in the Drug and Cosmetic Act? Then answer will be the 2. And if there is the question, how many schedules are there in the Drug and Cosmetic Act rules? Then answer will be the 18. So 2 and 18 both can be correct answer depending on the situation what the question is demanding. Standards to be complied under DNC Act 1940 for drug imported, manufactured, stocked and exhibited for sale or distribution are covered under. Now, as I have discussed, Drug and Cosmetic Act have 2 schedules, Schedule 1st and Schedule 2nd. First schedule mainly deals with all the important books or standard books which comes under the Ayurveda, Siddha, Unani system, while the second schedule mainly deal with all the standard related to the import, export, distribution, manufacturing. These all are the comes under the second schedule. So correct answer will be the second schedule. While Schedule A to Y all comes under the schedules of the rules of Drug and Cosmetic Act, while first and second schedule, these are the schedules of the Act of the Drug and Cosmetic Act. Correct? First schedule, name of books under Ayurveda, Siddha, Unani, Tibet system, while standard to be complied with the imported, manufacturing, distribution, sale of the drug, that is the second schedule. Next, as per the definition of the DNC Act, 𝙂𝙬𝙎, that is rubbed against the human teeth, is considered as all of you know, various peoples use the 𝙂𝙬𝙎 for the rubbing their teeth as a cleaning purpose, because it having 2 things, it having the tobacco as well as it providing the cleaning of the tooth. So that's why it comes under the cosmetic preparation. And this question was already asked in the Pharmacist and GPAT examination. So correct answer will be the 𝙂𝙬𝙎 comes under the cosmetic. So like cream, powder, toothpaste, 𝙂𝙬𝙎, nail polish, these all are comes under the cosmetic. Cosmetic means those substances which are used to beautify or they are providing the good appearance of our human body. So that is cosmetics. Which schedule contain different type of forms in Drug and Cosmetic Act rules 1945. So Drug and Cosmetic Act rules was passed in 1945. It having the 18 different types of the schedules. Here the question is form. All the forms comes under this which schedule. So correct answer will A for application. Means all the form comes under the schedule A. While B have the fees, different diagnostic and different type of the testing fees comes under the schedule B. Schedule C, that is called as the all the biological product comes under the schedule C, while schedule D, the drug which are exempted from the provisions of the import of the drug. But here the correct answer will be the schedule A. Schedule A contain various forms and format of letter for application for the licensing, etc. Second, have the rate of fee structure for the drug analysis by the CDL or the different testing laboratories. Schedule C comes under the biological and special product like surgical dressing, ophthalmic. Now again, C is divided into the two parts, C and C1. C contains the parenteral products, C1 contains the non-parenteral products. Schedule D, drug exempted from the provisions of the import of the drug. If you have the dream to be the pharmacist under this MRB Pharmacist Tamilnadu examination, then for the 425 post, then GDC have already started the crash course for the MRB Pharmacist examination, under which our live classes is continuously going on. Here you are getting the live classes which already have started from the 2nd March. Recorded video lecture, online test series, previous year MCQs as well as e-notes, everything under one roof, that is called as the crash course for the MRB Pharmacist examination. So how you can join that? Easily, just download the GDC classes app, and in the GDC classes app you will get the MRB Pharmacist crash course. Next question. Which one of the following comes under the Schedule C of the Drug and Cosmetic Act? Schedule C means biological and special product. OTC, not at all. Digitalis, this is non-parenteral, so C1 will be there. Surgical dressing, mainly answer will be the biological product comes under the Schedule C. Biological and special product, these are for the parenteral. Why? C1, list of other special product, that is the non-parenteral. C is injectable, means parenteral. C1 is non-parenteral, like digitalis, ergot, adrenaline, fish liver oil. These are the comes under the C1. Power of the drug inspector appointed under the power of the inspector appointed under the Drug and Cosmetic Act 1940 are mentioned under which of the following section? You basically remember the 3 to 4 section. That is the drug analyst. Remember this. Drug analyst appointed under the section 20, while drug inspector appointed under the section 21. Power of the drug inspector comes under the section 22, and the procedure of the inspection comes under the section 23. So you all have remember all these words. Here power comes under the schedule section 22. 20 drug analyst appointment, 21 drug inspector appointment, 22 power of drug inspector, 23 procedure for the inspection. So these are the different section and their description. Very important, various time question asked. As well as if you are talking about the Ayurveda Siddha Unani system, there is the two words 33G and 33F, because drug inspector appointed under the section 33G, while drug analyst appointed under the section 33F. Next, the schedule to which list of drug to be sold on prescription only. All the drug which comes under the prescription are put under the section schedules H. Yes, schedule H medications called as the prescriptional drug, because to purchase all these drugs you need a RMP prescription. That's why these are called as the prescriptional drug. Schedule G, these are the special product which comes under the taken under the supervision of the medical supervision. Schedule H prescriptional. Schedule X, these are the narcotic and psychotropic substance which is governed by special provisions, while Y contains the clinical trial requirement and guidelines, schedule Y. Under Drug and Cosmetic Act, Schedule FF contain the list of the following. You all firstly remember all the schedule, very important. Schedule F, biological blood bank. F1, these are the surgical dressing. F1 means all the sera vaccine, these are the F1. F2, surgical dressing. F3, umbilical tapes, while FF comes under the ophthalmic preparation. So here, drug which can be marked under generic names only, these are the Schedule W. Drug which are habit forming, these are Schedule X. Standard for the ophthalmic preparation, these are the Schedule FF. While drug which are exempted from certain provisions applicable to the manufacturing, these are the Schedule K. You all have the name. Now FF, that is the standard for the ophthalmic preparation. F, these are the blood bank and their operations. F1, these are the vaccine, sera and the diagnostic agent. We remember it as the VSD, that is the firstly we have the vaccine, then we have the sera, V, S and D. Part 1, 2, 3. F2, surgical dressing. Surgical have the 2 threads, that was the F2 surgical dressing. F3, umbilical tape. FF, ophthalmic preparation. You can easily remember all the schedule with a single trick which I already have made in the GDC main channel. You just visit on those videos, you will find out the tricks and mnemonics. You can easily remember all the types of the schedule. Good laboratory practices and requirements of premises and equipments is specified in Good Laboratory Practice, GLP, and requirement premises for the equipment, that comes under the Schedule L1. GLP comes under Schedule L1. GMP comes under the Schedule M. Correct? Schedule M, GMP. Schedule L1, GLP. So L1, that is the good laboratory practice. M, that is the good manufacturing practices. M have the two parts, part 1, part 2. Part 1, good manufacturing practice, premises material, and part 2 is the plant and equipment. M1 for the homeopathic medicine, M2 for the cosmetics, M3 for the medical devices, N for the need of the medical equipment for the running of the pharma store. So equipment for the efficient running of a pharmacy store. These are the Schedule N. Remember all the schedule with the tricks. Schedule M1 of Drug and Cosmetic Act deals with homeopathic medicine preparation. So manufacturing of the homeopathic and their guidelines, equipment, running, all these comes under the homeopathic requirement for factory premises, etc. for the manufacturing of homeopathic medicine. Which of the following is a Schedule X drug? X means narcotic and psychotropic substance, or we can say the habit forming drug. So here amoxicillin no, halothane no, thalidomide no, yes. Ketamine, that is the NMDA receptor antagonist, yes, it's a general anesthetic agent, dissociative anesthesia, and it comes under the Schedule X, that is the psychotropic substance. So here Schedule X have the dexamphetamine, methylphenidate, escobarbital. Next we have the methylphenobarbital, amobarbital, guanethidine, glutathione, ketamine, amphetamine, meprobamate, phencyclidine. Schedule X, these are the thalidomide. Schedule P means where any drug have the life period. So ampicillin, amoxicillin, bacitracin will be there. Intrauterine devices are tested at. Now we have the different type of the laboratories. Maybe it's central laboratories or it's state laboratories. Different laboratories have the different function. Like CRI, Central Research Institute Kasali, used for the diagnostic vaccine sera testing for the human. IVRI for the animal product vaccine sera testing. While intrauterine devices are tested at the Thane. Yes, Central Drug Laboratories, Central Drug Testing Laboratories, Thane. While Central Drug Laboratory, that is the major laboratory, Calcutta. Central Research Institute, Kasoli. Indian Pharmacopoeia Laboratory, that is for the pharmacopoeia preparation. So that will be the different thing. So here, Central Drug Testing Laboratory, situated at the Thane. These are mainly used for the testing of the intrauterine devices. So here, Central Drug Testing Laboratory, Thane, mainly for the intrauterine devices and fallopian rings. Central Research Institute Kasoli, serum, protein, vaccine, toxin, antigen for the human being. IVRI, Veterinarian Research Institute, Izzat Nagar, Mukteshwar, anti-sera, vaccine, toxoid for the veterinary use. Central Pharmacopoeia Laboratory for the sample of condoms, Pasteur Institute of India, Kunnur for the sample of oral poliomyelitis vaccine, Serological and Chemical Examiner to the Government of India, that is the VDRL antigen testing, that is the government central drug laboratory will be there. A new schedule was recently introduced in the drug and cosmetic rules for listing carbapenem class 3 and 4 generation antibiotic. Which one is it? Now, as all of you have gone through, in 2011 there is a new schedules which have added in the Drug and Cosmetic Act, and that is mainly for the reduce the misuse of the antibiotic. For that, H1 schedule has been added in our Drug and Cosmetic schedule rule schedules. So H1 for the reduce the misuse of antibiotic, all the schedule H1. These all are the antibiotic comes under the schedule H1. As per the Drug and Cosmetic Act 1940, if a drug is not labeled in prescribed manner, it is called as the misbranded drug. Suppose in any medical preparation, there is the like this type of packaging which is not written in the proper direction or not in the proper manner, so that will called as the misbranded drug, means not labeled in the prescribed manner. Suppose they have written the something word which can mainly give the false imprisonment regarding the drug substance, that is called as the misbranded drug. So it is not labeled in the prescribed manner. If it's so colored, so coated, powder, polished that damaged or concealed, if it made to appear better or greater therapeutic value, then it's really have. Means suppose there is no any greater value, but by color, coating, finishing, we are promoting, okay, our drug is so much smooth and it can produce the very good effect. So that will be the misbranded drug. While adulterated, yes, if there is the any type of the mixing, that is the whole or in part or any filthy or putrid decomposed substances are added, that is adulterated. Spurious, that is imported in relations to the manufacturing by the another substance or under a name which is belong to the another drug, that is spurious. Means we can say it false drug, that is the spurious drug. The application for the issue of permit import a small quantity of drug for personal use is made the license authority in form number 12A. Now, for different type purpose, like if we are importing any drug for our own purpose, means for the personal use, then we have to fill the form of the 12A and the license that will provided in the form number 12B, small quantity for the personal drug. But suppose if you are importing any drug for the testing purpose, that will made in the form 11. If schedule X drug is there, 8A application, 10A license, while CC1 substance, 8 application, 10 number form license. But this question I have asked various times. For the personal use, you have to fill the form number 12A and the license will be issued in the form number 12B. Who is the chairman of DTAB? DTAB, Drug Technical Advisory Board. Under the DNC Act, we have the different type of committees. It may be advisory committee. It may be licensing committee, or we can say the controlling authorities. We have advisory, regulatory and executive. 3 type bodies are there. So DTAB have the different type of member, 5 elected, 5 nominated, 8 ex officio. Under the 8 ex officio, we have the Director General of Health Services, which also serve as the chairman of the Drug Technical Advisory Board, Director General of Health Services, as well as what we have, Director General of Health Services, Drug Controller of India, Director of the Central Drug Laboratories, Director of CDRI, Director of CRI, Director of IVRI, President of PCI, President of MCI. These all are the total 8 member, which is the ex officio member under the DTAB. Out of that, Director General of Health Services serve as the major function, that chairman for the DTAB. The label Schedule X drug contains symbol in the left hand top corner is the Schedule X. So it will contain the red ink written word XRX, where we have here XRX word will be there, which denominate, yes, it's a prescriptional medicine, but which comes under the schedule X. So there will be the proper monitoring. XRX conspicuously displayed on the left top corner of label in red ink. So for the schedule X. The Central Drug Research Institute is situated at CDRI, situated at Lucknow. Yes. IVRI situated at Izzatnagar. CRI situated at Kasauli. Central Drug Laboratory situated at Kolkata. But correct answer here is the Lucknow. Central Drug Testing Laboratory, where in the Lucknow. CMAP is in Lucknow. Industrial Toxicological Research Center in Lucknow, Indian Veterinarian Research Institute in Izzatnagar, Central Research Institute for the testing of antitoxin, sera vaccine, these are the Kasauli, Central Drug Laboratory located in Kolkata, Food and Drug Toxicology Research Center in Kolkata, Laboratory for Serologist and Chemical Examiner to the Government of India, that is also situated in Kolkata. So Kolkata have the three different type of laboratories. License for wholesale of drug is specified in Schedule C and C1 is issued in. Now, this is most important. All the form for the retail sale, for the wholesale, C1X, other than C1X. But here, what we have question, that is the license for the wholesale C1. So that comes under the 21B. How you can remember it? Here is the all the wholesale form is there. Firstly, other than CC1X, other than those specified in CC1X application 19, form 20B. Now we have the CC1 excluding X. CC1 excluding X, where it have CC1 but not included in X, that is the 21BB with the motor vehicle, but 21B. So other than CC1X, 20B, CC1 excluding X, 21B. Next we have the CC1 including X, that is comes under the 20G. Drug is specified in Schedule X, 20G. Remember this word? Now you just remove this B word and you will get the license for the retail sale. Okay? Other than CC1X, 20B. CC1 excluding X, 21B. Schedule X, 20G. Come in the retail sale. For the other than CC1X retail, that will be the 20. CC1 excluding X, 21. For the Schedule X, 20F. Okay? Next. As per the Drug and Cosmetic Act 1945, the term drug store refers to license where the service of registered pharmacist is employed but do not maintain pharmacy. License who employ the service of registered pharmacist and maintain a pharmacy for compounding against prescription. License where drug are temporarily stored. License where service of qualified person is not required. So correct answer is the, it is a place where license who employ the service of registered pharmacist and maintenance of the pharmacy for the compounding of prescription compounding of the medicine against the prescription, that is drug store. Drug store means shall be displayed who do not require the service of a registered pharmacist. Here service of the registered pharmacist is not required, but chemist and druggist shall be displayed such as the license who employed the service of the registered pharmacist but who do not maintain a pharmacy for compounding, while pharmacy or the dispensing chemist, pharmaceutical chemist shall be displayed by such license who employ the service of registered pharmacist and maintain a pharmacy for the compounding of the medicine for the prescription. So that is the pharmacy. So you remember previously it was the drugstore. Before that it was the chemist and druggist. Then we have the drugstore. Now it becomes the pharmacy where pharmacist is required, where compounding is also carried out, where pharmacy is also maintained, that is pharmacy. Application form 19C is issued for the following schedule. 19C for the schedule X. 19C. Without C, all the 19, yes, that is for the C1 excluding X. But for the 19C, drug is specified in Schedule X. There is the application made in the form number 19C. Which among the following is an analytical agency constituted for efficient administration of DNC Act? Analytical agency. As we have already told, there are three types of the body. Advisory body. Next we have the analytical body. Next we have the executive body. Under the advisory body, we have the technical advisory board and drug consultative committee. Under the analytical body, we have the state laboratory, central laboratory, drug analyst. While under the executive committee, we have the drug inspector, custom collector, licensing authority, as well as we have the regulatory agencies is here. So analytical, central drug laboratory analytical, controlling authority, no, it's not analytical. Drug technical advisory board, it's also not. Drug consultative, it's also not. So correct answer will be the central drug laboratory comes under the, here we have the advisory body, DTAB, DCC, analytical body, central drug laboratory, state drug laboratory, government analyst, and executive body, controlling authority, licensing authority, drug inspector, and custom collector. These are the different type of bodies comes under the DNC Act. To complete your pharmacist exam preparation for the MRB Pharmacist, GDC have launched the two books, MRB Pharmacist Theory and MRB Pharmacist Objective Book. Don't miss this chance to enhance your preparation and get qualification in the final examination. Use this book. These are as per the syllabus for the MRB Pharmacist. You can easily purchase it from the Play Store of the GDC Classes app, as well as you can order it from the Flipkart and Amazon also. Loan license are issued for the manufacturing for sale or distribution of drug other than those specified in C1X. Means for the Schedule C1X, you cannot use as a loan license. But apart from that, for all the product, you can use the loan license. Loan license are issued for drug other than specified in C1X or drug specified in CC1, but for the X, never ever loan license can be applicable. As per the Drug and Cosmetic Act, chemist and druggist means premises for sale of drug which qualified person and drug are compounded, qualified person but drug are not compounded, compounding facility but qualified person is not needed, any experience holding person who can formulate the composition. Okay, qualified person needed, but there will be no compounding. So qualified person but drug are not compounded. Already I have discussed it. Registered pharmacist but who do not maintain a pharmacy means compounding is not carried out. The words, it is dangerous to take this preparation except under medical supervision, that is comes under the Schedule G, because Schedule G, these are the special drug which taken under the medical supervision. Schedule H, there are different type of the labeling parameters. Schedule G, it is dangerous to take this preparation except under the medical supervision. Schedule X, to be sold by the retailer on the prescription of RMP only. Schedule X, to be sold by retail on the prescription of RMP only. So these are the different type of the symbol which or the instruction which is given in the wrapper of any medicine. Chapter 4 of Drug and Cosmetic Act 1940 and 1945 give information about import of the drug, manufacturing of the drug. So correct answer will be the manufacturing, sale and distribution. Now how you can remember it? Here, first chapter we have the introduction. Second chapter, these are the different type of administrative bodies. Third chapter, that is the import of drug. Fourth chapter, that is the sale, distribution, manufacturing of the drug. While chapter 4 related with 5 related with the Ayurveda, Siddha, Unani, and chapter 6 related with the miscellaneous. So here I can easily remember it. That is the introduction, administrative bodies. Next we have the import, when we have the manufacturing, then we have the Ayurveda, Siddha, Unani and miscellaneous. So yes, IA, IM, next we have the AM. The function of the central drug laboratory is, Central Drug Laboratory, as its name indicates, Central Drug Laboratories, which tested or analyze all the type of the preparation. To analyze the sample of Drug and Cosmetic Act, yes. To issue loan license, to issue repackaging license, to issue the manufacturing license, no. To analyze the sample means Central Drug Laboratory. Obviously, it will perform the testing of the sample which is sent by the custom collector or the drug inspector to the different laboratories. Change in color of the hair and growth of new hair type of disease cover in which schedule as per the DNC Act. Disease comes under Schedule J. Mainly the incurable disease, or we can say the disease which cannot be cured. This comes under the Schedule J. There are the different type of incurable disease like AIDS, angina, appendicitis, atherosclerosis, baldness, blindness, bronchial asthma, cataract, change in color hair, change of fetal sex by the drug, congenital malformation. These all are the comes under Schedule J. Next and last question of today's series. The minimum required area to open a retail drug store, that is the 10 square meter. Yes. If there is only question regarding the retail sale, then 10 square meter. Only for the wholesale, 10 square meter. But if there is the question for the retail and wholesale both, then the answer will be the 15 square meter. So here for the retail sale 10, for the wholesale 10, combined for the 15 square meter. So these were the 30 question under the Drug and Cosmetic Act part 1. I hope these questions are very important, very basic. You have gone through this question and you get the clear-cut concept regarding all the points. If you have any query, feel free to ask. We are here to help you. Thank you all.